Hey, everybody, we are live on Facebook now, EMS Underground. I am Charles McFall. There's Tommy Tom. And way in the background over there, we've got Michael joining us today.
How's it going?
Now, Michael, you suffered under this man like I have, right?
Oh, for about a year and a half.
Suffrage.
But now you're actually going on to paramedic school and
Correct.
working on those things.
We infected him.
And as you came in, because we always solve for time a little bit because we have to do sharing and liking and all this other jazz. But as you came in, we had another student here. Anthony was here talking about the advanced chapter 5 human body chapter with
chapter.
5 hours of lecture.
No, that's all?
Yeah, dude, you go crazy on that on that chapter. But I gave him the
I
advice.
think I need to add a little more to it.
Ah, God, I hope not. I gave the advice that Jason Hale gave me. That more than likely will not be on your national registry. Just get past the test. And what I've added to that is like if you can pass that test, you're going to pass any test because your tests are
the problem
insane.
with that is that you will not see any questions that are going to pop out at you and say, "Oh yeah, what is a femur? Oh, list the 21 steps of blood flow. Oh, where are the coronary arteries?" You won't see that. The problem is that chapter's embedded in the questions. And if you don't understand that chapter, you probably won't understand the questions.
I don't understand you, so does that help?
I mean,
you know?
that does help.
I could agree.
You know?
How long ago did you go through the class, Michael?
Well, I went through the program that was the basic class with the advanced class. So I want to say we started in January, ended up graduating in roughly December, and then we started again, I want to say in February. I think we took January off and then graduated about May-ish, if I'm not mistaken. I could be wrong on a couple of those dates. But it was probably about a year and a half ago, and it was definitely a learning experience, needless to say.
It went by fast, though, didn't it?
It did go by fast. It did go by very fast, and being that it was computer-based and, a lot of it was on my own time, there were days I could jump ahead, and there were days that, something came up, it could lag a little bit, but it was well worth it.
So you did, it sounds like the 10-month EMT program?
Yeah.
Mm-hmm.
And people think, man, it's so much time, but it really isn't.
No.
I mean, it flies. Well, because you lose track of time, right? Because as a student, I got 10 months, I can do this, I can do that. And now you've got to be hitting, what, is it 1 or 2 chapters every week?
Yeah, it does. The problem is if you don't stay up on top of it, it's gonna build up on you and become a really.
I hit mute. Shut up, TV.
It becomes I don't want to say a burden, but then it just becomes such a hassle that you have to catch up on everything because you let yourself get so far behind.
Yeah, I actually did that a little bit in my advanced class. I was like, I got time. I'm only like a chapter behind. And then Vanessa had to go, you're like 8 chapters behind, and you need to get this done. I'm like, well, Tom made me work. It's not my fault.
Yeah, like nobody else has a job.
No, of course not. Did you work when you went to school?
I did. I actually worked overnight. I still work overnight. I enjoy nights. And slept during the day, but a lot of the job that I had it was just simply as baking donuts overnight at Dunkin' Donuts, and
Hey, let me ask you a question right quick, just not to stop you. Do they really come pre-made and you just kind of warm them up?
ooh, I don't know, that could get me in court being on live.
Okay, never mind. I've heard rumors. I like seeing mine. I like my Krispy Kreme. I'll eat a Dunkin' Donut, but watching them come off the conveyor belt and right into your box and right.
They're still good, even if they
are
are
good.
warmed up.
They are good. I will give it that.
Better, right?
They are.
Yeah,
I do. I will give
I think
that.
every time the light goes on at Krispy Kreme, it should include a 1,000 bag of of fluid so it can flush out the
diabetes.
The
that you're about to
yeah.
ingest.
Hey, I'm not saying.
Yeah. That's absolutely right. That light is the devil. It is the devil.
It is, and there's a rule. If you pass that light and it's on, you have to stop. I mean, that's just the rule. Got to stop. It is what it is.
You know, thousands of Americans will agree with you on that rule.
Yeah. Got to keep the healthcare system going somehow.
It keeps me employed.
Oh yeah, keeps us all employed.
So you're a full-time advanced EMT.
Correct. I work for AMR of DeKalb. I enjoy my job. I work overnight, as I said. It is, to me, it's a lot of fun. It's the job that I wanted. I knew the call volume was going to be high. I knew, where I was at, was going to be a serious area that had, anything from diabetic emergencies to gunshots to stabbings, and I'm very happy with it. I enjoy what I do.
Good.
That's what you need.
always important. And that helps. Some people try to get into this field, and it's because it's cool. It's going to be fun, and they lose track of the time. Or it's work. I mean, it's a lot of work to work and get through school, and then once you get into the field, it really doesn't slow down. I mean, you combine it all into one thing instead of spreading it out over a bunch of time, but it's a lot of work. But you were in the military, you were saying, as well.
I did 4.5 years in the airborne, first
Cool.
of the 509th Airborne Infantry.
Airborne?
That's right, all the way. But and one of the things that I really learned in that field that really carried over into this field is that no matter what happens or what I do it to the best that I can, whether it's providing for the patient or providing protecting myself and my partner. I've got to do it the best of my ability, and if not, then I'm letting somebody down, whether it's me or my partner or the patient. So I really feel like that was a good stepping stone, and then following into EMS was a very good stepping stone as well.
That sounds like that's what you were built to do. I'm playing with the features on this thing. It is not working out as well as I'd like it to. Are you done clicking? Can you talk for a minute?
I'm trying.
You try.
Man, we just got
You
so
got
many
all
people that
5,000
follow
of your
us.
friends.
Got to get it out there.
So we're going to talk about test taking today a little bit. We're talking about anything else that comes up. We're going to talk about anything that people ask. I did just pass the National Registry Advanced. So I've literally
How much
passed
do you pay?
every
How
national
much
registry.
How'd you get through that again?
I'm bigger than you. And I stood over. I held your Reese's hostage. Say, you ever want a Reese's cup again, you're going to have to hit pass on that button.
I guess I'm getting Reese's.
So that's a little bit weird looking, but we're going to go with that right now. So I'll quit hitting buttons and we can talk for a minute. And so I've taken the National Registry Intermediate. I've taken the Basic, the Advanced, and the Medic now. The only one I've never taken is the First Responder, which I will never take. I don't see a reason to take it. But my path was I went to Intermediate, Paramedic, got out of the field, got out of life, let it go. Came to do videos here, and Tom somehow. Actually, it wasn't somehow. I remember clearly I was sitting in this chair that somehow sinks when you sit in it. So that somehow makes Tom looming over me and goes, "You're in this next class. You're doing this class." And turns around and walks out like, "Okay, I guess I'm doing this class now."
Did it just like that, too.
And because you were tired of me putting it off. And that was in February. Or actually, it was January, I guess, because the class was in February. And I get so much grief from Steve and Vanessa about how I didn't finish on time. I was like, I still finished.
Slacker.
I was only technically in a 1 week of extension, but still got it done. And I was slacking. I mean, and that's the thing. So let's talk about, before we get the test taking skill, let's talk about educational skills, right? It takes focus, especially the way you did. So nowadays, just for everybody watching, when you come to this class now, it is 10 weeks, maybe 16 at the max. You're coming 2 nights a week. And you're still doing chapters in between, but you're getting extra help. You're getting lectures now on some nights. You're getting extra review. You're getting all this. But you're done in 10 weeks. You're done. You did it in 10 months, which means you came to class 1, maybe 2 times a month. for 4 hours.
Yeah.
Everything else was on your own. You had to watch the lectures. You had to read the books. If you wanted help, what did you do?
A lot of times, we actually set up a Facebook group that we were able to talk back and forth with. And then a lot of times we would come up here and we'd meet with an instructor, maybe a couple hours before class, or hey, if everybody was cool with Friday, we'd include an instructor and say, hey, we plan on coming up here on this day. Would you be able to, would you be free? And many times, so there was never a hassle. We'd show up and, whether it was doing IVs or if we weren't sure about, advanced airways, if it was always a question we had that, somebody would answer. There's always that, everybody has another job. So we would email and, we'd maybe wait a couple of days. But, there was always somebody who could answer your question for you. So, that's a big thing, is being able to get that question answered.
Yeah.
So doing the group, that helped a lot, didn't it?
Oh yeah.
Being in the group, and being here.
Being with other people that are struggling with you is a lot better than struggling on
Struggling
your own.
together is definitely better than suffering alone, for sure.
But there is too a personal responsibility with it, right?
Oh, yeah.
There is, because the program coming into at least our program here isn't one where you've got to take some personal responsibility and watch the lectures and do the work, right, before you come in.
You're not gonna learn it through osmosis. I mean, you have to put as much effort into it as you would.
And if you don't watch the lectures, read the book, and do the work at home, when you come to the lab, you're lost, right?
Very lost. We had a couple of people like that, and you can see the people that don't put the time, don't put the effort into it,
And I think that out of your group that came through, y'all that stuck together went through this, all of you passed, right?
Correct. All of us have our advances now, and all of us are in EMS all
Working
around
somewhere all around Atlanta. Yeah. But in your class, and you can remember this, and I remember, that there were some in there that was not watching their lectures. They were chapters behind whenever they would come to lab, and they would be lost, wouldn't they?
Oh, they'd be lost, and it's not something that you can say, well, I watched a YouTube video on this. I'm pretty good at it. It's something that you got to read, and because there's so many rules, there's so many regulations, there's so many, it's not just man, I figured it out overnight. I'm good. A lot of discussion happened, a lot of book reading, a lot of, there are YouTube videos, but, some people are out there giving you the wrong information. So.
Right. Yeah, and the best information is, what we're giving you right from the book, because it correlates with the book, which is going to correlate with, hopefully, that exam.
That's correct.
Yeah, you would say what you said would be the best information, wouldn't it?
Mm-hmm.
Yeah.
Of course.
We actually had recently people show up and hadn't watched any of the lectures.
Yeah.
And so it's two different classes, and both instructors separately went, tough. Instead of learning, instead of interacting and doing labs, now you're going to pull up your laptop or your tablet or your phone. And with your headphones, you're going to watch it. Which at first I thought, wouldn't it be a little more, because when you're doing it on your own, you still work at your own pace, right? You still do your thing. Mm-hmm. It's a little more punishment to put it up on the big screen and have everybody watch every second of it together. But then I realized it wouldn't count it in their classroom, so they were doing it individually. But that's the thing. Going back through as I did on my own, after being a medic for a while, and I'd been out of the field for a while, there was definitely things I went, oh, I was surprised I remember that. It just went with the instinct. It was right. It's wow. It's stuff it just gets ingrained in you. But there was stuff that I didn't know, and there's one or two questions. I sat Tom down angrily and like, why is this question on this test? I know for a fact you will never use that in the field. It won't work. You don't do anything with it. Because it's a straight memorization thing that's wasting my brain space. He goes, well, we've had students come back and say that's on National Registry, so don't learn it if you don't want to. And he walks out, and I'm like, crap.
It's up to you.
All right. Fine. But, okay, so medic school. Clarify for us now, because I've heard a bunch of different things. How long is your particular medic school?
Mine, I started in October of last year, and I graduate December 3rd.
So 14 months, roughly. And how many hours of practical are you having to do?
Oh,
Not practical, rotations, clinicals.
we're having to do a total of, I want to say, now don't quote me 100% on this. I think it's roughly about 240 hours.
That's what I heard,
on a
around 200 plus hours.
Yeah,
Wow.
on a truck, and then in the hospital setting, it's roughly about 100. But we've divided ours up in between like labor and delivery, psych, OR. OR is really good as far as intubation and stuff like that. And you can, and we also did cath lab, which is really good because we deal with a lot of MIs, we deal with a lot of STEMIs, and what's interesting is to see what happens from we deliver to the door, and then from the door to balloon time, we don't really pay too much attention to that. That's not our, really our area. But it was really good to see how quickly it happens and what's so involved in it, and
get an understanding.
Yeah, and so I was really impressed with when I got to do cath lab.
Did you work with other medics there? Because I know back in the day they used to hire a lot of medics to work in the cath lab.
The thing is I got to sit behind a window and watch, so it wasn't really too involved. And as I said, it happens so fast. You think of when we call it in, we're riding emergent, we're holding on, we're poking and taking EKGs, and our time flies. We got 20 minutes, and at 20 minutes we're even kind of worried. We get there and we rush them through the door, we get them to the cath lab, and then we get our signatures and we go. You have to understand, them guys have our ETA, that's their time to get prepped.
Yeah.
And it was interesting to see them, come in, prep in a matter of minutes. We come through the door, pass it off, and then bam, they're working.
Wow.
And them guys were on top of their game. We think we're fast. Them guys,
They've got it down.
they've got it
Well,
down pat.
would it be a fair assumption to say that, like, for your paramedic clinicals, it's probably roughly close to about 500 hours by the time?
Oh yeah.
By the time you reach because it's not just the minimum hours. You still got to see, so you got to get so many med men, so many airway management, so many ped patients, so many geriatrics, and a lot of team leads. There's a lot of team leads, right?
Oh yeah. You have to have we have, in the program that I'm in, you have to have 72 hours of team lead, but you have to have 20 patient contacts within that.
So and you got to keep going until you get them.
Until you get that 20.
So okay, because I saw that on our advanced, right? Now for comparison, my paramedic experience was 6 months of class. They kept jerking us around whether or not we were going to get a contract to do a clinical at all, or if they say it was going to sign us off, which was scary because
Explains a lot.
I was working on a truck with good medics, so I'm just saying I was okay. But the rest of the
With
students,
me,
I don't know.
he worked with me.
But I was an full-time EMT, and that was the thing. Well, I'll get back to it. I want to ask you a question later. But my comparison was they rushed it, so we had 60 hours of ride time, 8 hours, and it was broken up. 8 hours we had to do pediatrics. We had to do 8 hours, which was neonate basically. I went and played with the babies and got to see some C-sections done. With C-sections on twins was really cool. Then I got the OR to do the intubations, which I really appreciated. A few other little things, but we didn't have 72 hours of team lead. We didn't have team lead at all. It was rush. Okay, you meet the bare freaking minimum. This is in 2000, because I failed it, got married, and then by February retook it and passed the registry. So I didn't fail the class. Well, I say I failed it. I failed the registry. I passed the class. 72 hours of team lead. What does that look like? You go in and go, okay, are you in the hospital? Are you in the ambulance?
These are 72 hours of ride-alongs. You
just have to do it all.
You have to do it all, and you have your person there with you that is obviously your proctor and stuff like that. And But they're pretty much, hey, this is your truck. I'm your EMT. The roles are reversed. You tell me what you need. Let's see what you know. And
so I actually got that on the truck, just not through the school. My paramedic partner throughout school, and actually all the paramedics I worked at during that 6 to 9 months time were very much hands-on, and my regular partner would do that to me. He goes, okay, you tell me what you need. Because he'd track and know exactly what I'd been learning. And a lot of times I'd actually leave shift, go to class, and come back, and he'd grill me on things. It was so brutal. But he made me a good medic. But I just did 4 hours plus an hour of drive time each way. I'd rather just go to bed. He said, nope, you want to work on my truck, you're going to do it my way. And he would just grill me on what we went over that night. But I did get a little of that. So it's not a specific assignment. You go in and the preceptor goes, all right, you're the captain now.
Right. Now, we did 108 hours of actual just ride time, just ride-alongs, 12-hour shifts. And, in those 12 hours, you're riding with, your guys that, same instructors that you're in class with, and stuff like that. At least I was for Henry County. And what was awesome is, these guys were like, they were good to get you out of your comfort zone. A lot of them would tell you, why are you stopping to think about this? We just went over this in class. You know what you're doing.
Yeah.
We've talked about this in class.
Mm-hmm.
Why are why are you hesitating? Why are you delaying that treatment? You know what to do. And I'm bad about that even as an advance now, is taking that pause, that moment where I'm kind of like, man, what is this really the right treatment I want to do? But knowing in my head that, yeah, it is. Why are you delaying this? Just go ahead and do it.
And that can roll us right into test taking skills, right? Because people try to separate that too much. Is they come in here so nervous about the psychomotor exam. I'm like, you literally have done this your entire class in EMT. The class before the test, you just went through the psychomotor exam without the pressure of having to pass. It's just do what you know. But then they separate that to the cognitive. I kind of did the same thing. Is I can ace hands-on anywhere. I went to cognitive, and the very first question, I was like, I have no idea what it's asking. I don't know what it means. I have never come across that in the field in my life. Eeny, meeny, that one. And then next. And then I started picking the questions. And there were definitely some that I knew the answers. And would you say one of the best test-taking skills, either psychomotor or cognitive, is you know what you're doing, just do it.
Just do it. And one of the great things that I've always felt is that, I even tell this when, I've had third riders on my truck, is just speak what you're doing. Say what you're doing. If you're checking this patient's airway, how hard is it to say, okay, I'm going to look at this guy and see if he's making eye contact with me. He's making eye contact with me. Is his airway open? Is he breathing? Okay, I can see this stuff. These are the things that I can see. I'm going to put my hands on him, feeling that he's, he's cold, he's cool, he's clammy, he's diaphoretic. These are things that you can voice, and it's good for you. I still do it in the field sometimes. I walk up and I'm like, okay, I'm doing my assessment. Looks like his airway's open. He's clear. I start going down the body, and it's just funny. It's life skills that you pick up.
Yeah, and that was my initial struggle with any of the labs out here. Was I was a medic for 10 years, and like you're saying, you verbalize that. At some point, you don't. You're just it's second nature. Mm-hmm. You walk up, and when you write it, you're writing all this stuff, knowing that in 5 seconds you walked up, he made eye contact. He's talking to you. You could see the skin color. And at the second number 6, you actually kind of grabbed his hand or did something, and you felt all that, and you're writing it. And here when you do the psychomotor, you gotta verbalize everything, and that's the difficulty part. But for most students, they haven't internalized all that anyway. I know one of the things that got me past the National Registry cognitive test was picturing it in my mind, and I was fortunate enough to have had all that experience to fall back on to go, okay, you're asking me this, but I know this doesn't matter, that doesn't matter, that doesn't matter because of this line here. If I'm picturing in my head and all of a sudden I'm getting vitals, but this happens, whatever this is, all of a sudden they pass out, go unconscious. What am I going to do? Well, the first thing I'm going to do is open the airway instantly. I've done it a million times. I'm going to put oxygen depending on the situation. Even though I've found out now, apparently oxygen causes cancer like everything else. I don't know. Too much oxygen is bad.
It'll kill you. Okay,
you got a 96% O2 sat. I'll throw oxygen on you. Nope. Not anymore. But you do that, and I think practice tests are a good way to go because I found out it's desensitization, which is what you're doing with your 300 plus hours of clinicals. It's not, oh my God, there's a skid hurt. It's, okay, this kid, I mean, it's really clinical, isn't it? This kid presents with, patient, this adolescent patient presents with bam, 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 and yeah, you're going to go in and talk to them as a human being, but you're already in that mindset of, I'm really dealing with the math on the paper that they gave me, the science on the paper, whatever you want to call it, you know. So I think test taking, I did it over and over again so that it helped me even remember keep it simple. Because medics are known for making it complicated. We do. We go right to the, oh, you're not breathing well. Let me just tube you real quick. Done. RSI. Throw you down. Put a tube in. We're fine. And in reality, it's put your PPE on. Mm-hmm. And I found that through the basic one a lot. And that's one of my tips for the basic class. If you're taking the EMT certification, if a choice is take standard precautions or put BSI or PPE on, that is the answer, because they're trying to make sure you're not zooming past taking care of yourself first. Tom, you're not saying a whole lot. You're typing a lot. You got to stop
in the
that
chat room.
Russian chat bits. That
I'm talking in the chat room.
I'm talking in the chat room. So you've been doing this forever. You've gone through level 3 instructor. You've gone through all kind of tests. What's one of your number one go-to test taking tips?
Make sure I know the subject matter first. That's one of the things, and I've started doing this here whenever students are coming up and they're not successful on the registry. What I've done is, instead of having a multiple choice test, I've made a almost 90-something question just test. No multiple choice. Fill in the blank. Here's, list the signs and symptoms of this.
If you can pass that, you will get it. You'll get multiple choice like that. I just hate those tests.
Yeah, but it's what you got. Because what I'm found is that the people that are having problems with it, they don't know the core things. Like, what's the signs and symptoms of an acute myocardial infarction? You got to know that. You got to know all of it, because the registry is not going to give you a cut and dry question, and there's more than one sign and symptoms, and not everybody has the same sign or symptom of that. Same thing with stroke. Not everybody presents the same, but you need to know them all. Do you know all the indications and contraindications of the procedures that we do and the medications that we give?
Thank God for multiple choice.
You
do. I mean, when you're fresh, right? When you're young and doing it, you can name off all that stuff right now.
It's fine if you know it. It's fine if you've learned it. But if you're going into the test and you've taken the test 3 times and you're wondering why, well, I'm doing great on these multiple choices. How many of those multiple choices are you guessing and getting right?
Yeah.
And whenever you get to the registry, it's a bit harder. You need to have a good foundation going in.
I agree.
And if you've got that, and if you're having problems, that is my thing. Okay, before we get started, here, boom, I want to know what you really know, not what you're guessing at and getting right.
Yeah, but you don't test that way here, right? Maybe the midterm should be that. Yeah.
Yeah.
I hear a whole bunch of students screaming at me right now.
Yeah. They're hard to grade, but But if you're taking it serious, if you're going through and you're reading your chapters, you're taking notes during the lectures, you are studying before you take the test, and not just where people will get into issues with test taking is that they will do short-term things. They will learn stuff for the short term just to pass that test tomorrow.
Yeah.
Or this evening. I'll get in there and I'm going to cram, study it. Then I take the test. You know what? I passed the test. And then they never go back to it. Oh, I passed that test. You can't do that.
Yeah.
Learning it is like a marathon,
Carly says number 1 is a sure foundation. Number 2 is not to panic like she did. And then that's key. I'm going to get to the psychology of
and Carly, you're exactly right, Carly. A lot of people do panic. And it's not that they don't know the material.
Right.
It's just they panic and freak out whenever they're being tested. When in reality, because there's a lot of people, whenever I give them that paper test, they do good on it. And then that also tells me, hey, it's not a knowledge issue. It's either a confidence issue or, maybe you're just putting too much weight on your shoulders and
Yeah.
it's freaking you out.
Yeah.
I think that has to go with the psychology, though, of it.
Yeah.
I mean, some people are test takers and some people aren't. You walk in there to take a test, and I mean, you're literally the last 6 months to a year of your life is on the line of this next 45 minutes of this test taking because you've put all this time and effort into it. And then that goes in with the fact that you're only going to get out what you put in. If you took the time to study, if you took the time, to actually open your book and read, then you're going to have that knowledge, that basic, simple knowledge. I mean, I'm not going to lie. I'm not a reader. I don't, it took a lot for me to open a book and read it. But to actually say, hey, I've got this basis that I can, that I can go off of. And I'm not going to lie. It really didn't hit me in the classroom. It didn't hit me when I took the test. It hit me when I was on the truck.
All right.
Because when I would get a patient, and I had a really great paramedic when I first started off. She was real good about, okay, this is what you got. What are you going to do? And I could look at somebody and they could look at me going, well, I've got abdominal pain. Well, what are you going to do?
Yeah.
What are you going to do? There's hundreds of things we can talk about that's wrong with the abdominal.
Right.
Pertinent negatives is something I wasn't really taught. I was taught it, but I wasn't really taught it hardcore in medic school. But that I found myself falling on old habits on these ride-alongs because I always tell them, I'm a former medic, so don't get thrown off or anything. And I would get treated differently because of that. But I said, I need you to help me figure out what I'm still weak on. And one of the last rides I did was with a great medic and a great advanced student, or a great advanced EMT rather. And they were just gung ho, they're eating it up. And we had a complicated call with a child. And we were going through and I could tell he's doing it in his brain, but being in school and even on the truck, I was always teaching people. I always had ride-alongs, always had students. So I was just openly saying, okay, we know it's not the heart because of this. We've done this. It's come up. It's not great, but it's come. And then he started talking to me, and we just openly were starting to do it. But as a medic, you do that. As an old-time medic, you do that. But you don't verbalize it enough. But I think if we teach the students, you really just start talking it out. Well, it's not this because we did X, Y, Z, and this changed or didn't change. We did this. And the ultimate answer in this kid was hypothermia, essentially. If we can just get her warm, everything should come back to normal. And you forget that going into the test, the psychology of the test. Well, let's talk about the psychology of the actual test taking. Is first off, if you say you're a bad test taker, you're going to believe you can't take this test, and you're going to have a difficult time. So you really got to know, I know this, I got this. Like I said, it hit you on the truck. Even as a team lead, you were saying that your preceptor was going, you know what you're doing. Why are you waiting? Why are you not doing it? You know what you're doing. Because even I fell into that. Long time history of medicine, I walked to the truck, and I go, well, I'm the student today. And I feel like it had been, man, I had not stepped foot on a truck since 2012. So this was 5-6 years. It'd been since I've been in the back of a truck, and I was like, man, it's old. I feel rusty. I feel out of my element, and I almost got that I don't know what I'm doing mentality. That's easy to get, and got in there. But once the best ride I had was actually with Lynn Pitts and Stephanie. One of the best rides was Stephanie Forsman, where I told her, because she knew I was from being here. I was here right into her class. And she's like, oh, you're used to, I thought you were a teacher. So, well, I'm not a teacher, but I was a medic, And both of them, instantly you could feel that energy of, now Lynn knew what I was doing, knew where to help me, but also respected that I had done a higher level. And Stephanie, of course, the same way. So I felt when I was a medic before. It's like, these are my EMTs, and we all work together. Because I never thought I was better than anybody else. We all work together well. It's like, that's the feeling I'm missing. It took me 5 or 6 rides to get back. That's the feeling. I do know what I'm doing, and that changed everything from there going forward of, no, I'm good. Yeah, I might forget one thing here or there, but I still am who I am. When you go to take that test at the Pearson View Testing Center, you go through all this security that is really nothing. I mean, I've had background checks, all kinds of security issues in my life, or not issues, but checks in my life. So going through theirs is easy. It's like, oh, you get my handprint, cool, here's my picture, done. But you do it, and then you gotta walk around the corner and do it again, and they push you through this stuff, so you're already kind of getting psyched out because you're focused on that test, and now you're getting hit from the left doing that. Then you go into that room, and it's dead silent.
Oh, yeah.
It is so quiet. and you
There's that one
start-
girl in the corner crying. So,
Carly was there. Awesome. Yeah.
She's online.
Yeah, I know she's there. That's just giving her issue. You hear little clicks, you hear little things, and it's just overwhelming silence, and you don't focus on you got this. You focus on everything around you, because when you're practicing, you're in the back of a noisy truck, or like here, I was practicing my tests here in my office, and I have my fans going. People are coming in and out. Noises everywhere. You don't realize consciously how much noise is surrounding you. That's your comfort level.
Yep.
And you go and it's gone. And all of a sudden now you're really out of your comfort zone. And I think that throws a lot of people off. I had to, didn't think I would need to, but I did. I ended up putting on the noise canceling headphones, so now it's dead silent, but I'm used to having headphones. So now I'm in my comfort zone of I've got something on my ears,
So
and I
I'm
can
start
focus on
calling
the
him
computer.
headphones.
And that I felt like that was the only thing that threw me off about the test was I had to get myself back in order after going, man, it's quiet, there's people clicking, it's crazy. And once I focused, I actually did some meditation breathing, and then it's like, no, okay, here's the question, boom, here's what. And I did not let the ones I didn't know bother me. I was like, nope, I don't know those. Nothing I do is going to change that. I don't know it. Pick an answer. And then when I found the ones that I absolutely know that answer, I felt good. And then there was some that you just went with your instinct on, because I should know. I absolutely should know whistle tip versus
A yonker.
a yonker, and what you use it for. And I did not study that at all. I didn't go back over it all through our refreshers. And it comes up. I had a question on both and went, my gut says I'm going to go with that one for this. And then when I got a different question, I picked the opposite one. Don't know if I got them right or not, but it's a thing. I just remember I use whistle tips for everything, I think, pretty much.
You probably use yonker for everything.
Maybe.
you know,
I probably did.
I think on our truck we use yonkers for pretty much
Yeah,
everything.
so, I mean, it's like, I remember I was
The
supposed to know
whistle
the
tip
difference.
is the little thin one that's about the size of this.
And that's the one that you wouldn't use, you would not use to get debris out of the mouth.
Right.
So I got the questions wrong. I flipped them.
Got them
I
flipped.
flipped them. But
Carly makes a good point here about not many preceptors teach anymore. They just pretty
Yeah.
much are shut up, sit down, rare to see anymore. And she's right. I mean, preceptors are valuable thing. Now, some paramedic programs, I know, like Michael's going to Henry County, and you ride in Henry County Fire mostly, so they have a lot of control over their preceptors.
Right.
So, but whenever you were going to other programs where you're relying on, like, you're going to AMR one day, you're
and
going
not everybody
to,
there's preceptors. You
Yeah.
just ride.
yeah, and you're supposed to be preceptor. They're supposed to be putting them with.
I think they're
Preceptors,
overloaded. I mean, AMR runs 40 some odd trucks during the day,
Yeah,
and I would say a good 80% of those trucks always have a student on them, if not all the trucks. So, I mean, you don't have 40 preceptors during the day and 40 preceptors at night. I think I got one preceptor. The rest were just old timers or just this is the truck we have.
well, we've got our preceptor course almost up and running. The only thing I got to do is make some tweaks on the certificate that you get at the end, and the rest is done. And then the state is going to go through it and look at it one more time, just make sure that there's no more tweaks they want to add to it, and then we'll be putting it out. And that's going to be a free class. So anybody out there who's wanting to precept or wanting to know more about precepting, here at least by the end of the month, we'll have a free class up for people, and it's worth I think 16 hours of continuing education.
Sounds right. Yeah.
So you can get 16 hours of free con ed.
I mean, that's always a good thing.
Oh yeah.
Yeah.
That's always a good thing. What's in hindsight, if you can think about, what's one of the worst things you did to go into a test that hurt you?
One of the worst things I did was not get enough sleep
Oh, people do that all the time.
And
They
not
stay up
eat.
all night studying
and
yeah.
not eat breakfast.
No, yeah.
Because that just just distracted me even more.
I was the guy that you saw out in the car that was reading over the paperwork.
Again, right
Again.
before you go
One more
in.
time.
Yeah.
And then when I got it on the test, I totally didn't remember what I just read 20 minutes ago out in the car. So
Yeah.
that's mine. I've gotten to the point now where if I'm going to take a test, I stop the night before. That's it. We're done.
Good.
that's it. Let's go to bed. I'll even watch a movie with my wife, my little girl, or and take something totally completely away from paramedic.
Just to relax.
Just to relax.
And you notice that a lot of the
Yeah.
football teams now, like college football teams and stuff, are starting to do stuff like that with their teams the night before by watching an inspirational movie or something to help them relax before they go into the game. And I assume other sports are doing that.
I've seen it both in professional and college football. When we worked one of the big hotels downtown, we'd get some of the teams that would come through for the bowls or whatever, and they'd set up and they'd have all. And I was on the AV, so I was always setting up the TVs for them and setting up the rooms for all that training. And you'd see that all through the week. They'd just be hammering on the schedule. They'd go work out at this field. They'd come watch these tapes. But the night before the game, it was here's the arcade room. Nobody's to worry about anything. Go have fun. Of course, keep it. You don't want to go out drinking and partying all night.
Yeah.
You got a game tomorrow. But here's some fun in house because you got to stay here. It's the curfew. And yeah, they kept them away from worrying about it or thinking about it. It's just relaxing.
relax.
Deidre Collins says, second guess yourself.
Yeah.
I caught myself because you can flag questions for review on the test. I think I flagged like 6. And I went back and I was like, yeah, no, that's good. Yeah, no, that's good. And then one of them, I was like, man, is that? And Jason Hill again helped me out. He said, there's always a 50-50. You can almost always take any question. Well, he says always. I don't know if you can do it always. But you can almost always take any question, take 2 answers that are absolutely wrong, throw them out. And then there's 2 that are, you got a 50-50 shot now. And I almost swapped it. And then that ad is, do not change your answers. Do not change. Just go with what your first instinct was. Because we've seen it on tests that we grade here. We've seen it at CPR for sure. Is
Yeah,
I'll see
people
people
love it.
cross out something. I was like, no, you had the right answer, and you changed it. Second guessing yourself will kill you. I think, and this is a hard one to explain. For me, I think caring too much is one thing I've done wrong. It's why I failed the paramedic the first time. And I mean, as you focus, it's that phrase you said, this next 45 minutes is going to negate or prove the last 6 months to 12 months, blah, blah, blah. And it really isn't.
No.
And ultimately, you can do it
And
again.
people
you can do it
mess
again.
up.
No.
And sometimes,
Yeah.
I mean, you.
But you get yourself hyped up. And that's the same
Yeah.
thing with medicine. You'll
It's like,
go in and like,
it's like Carly said here. I mean, Carly said she puked. I mean, and the reason why, probably so hyped up, that you get so hyped up that you get yourself physically sick.
yes,
you know,
people do that.
And we've
do
seen
that.
that happen here, like on the skills test. How many times on a big registry have we
Yeah.
had students is like, and they're in the
Vomiting in the
bathroom,
bathroom,
vomiting in
yeah.
the bathroom,
Yeah.
and we're like,
yeah.
chill, we're not going to hurt you. I mean,
Yeah. And I try to come out ahead of time and do that whole, nobody's going to die today. Everybody's going to be fine. The worst thing that's going to happen is you didn't get a
Have to
piece of paper.
retest, or
You'll
you
take it again.
retest, or-
Breathe. Because I agree. I think that's the toughest thing. And it'll mess you up in the field, too, is you get hyped up that this is somebody's mom or this is a baby. Everybody has their thing. Or, some people don't. But the ones who get worked up always have a thing. Oh, kids mess me up. You're caring too much. Then you lose. When you do that, when you focus on what this could be, and what it could mean, and get hyped up and
It messes up
overpressurized
what
on
it will be.
you miss what is. You miss
Yeah.
what's going on, and you do it with the test. I know a number of people who you'll sit here and they've aced every exam through our school. They're star students. And you could throw questions at them left and right, and they'll get it, and they'll fail the registry. Why? Well, I studied, I did it, and even when they're telling you the
was up all
story,
night.
when they're
I don't
telling you the story, that
understand.
stress level on you is
Yeah.
rising because they're putting.
It's like,
Whoa.
I was up all night studying. I don't know why I did so bad.
Yeah,
Maybe
yeah,
because
breathe, baby.
like Carrie's listed right there, she gets high anxiety. And that builds up that anxiety.
They change that
Because
reality.
that
I
book
get by.
is so big and the test is so small. And it's like, what's going to be on the test? I don't know what to study.
We've already got a few students here that are just go-getters and focusers like that. They're like, what's going to be on this exam? Breathe is what's going to be on the exam.
Yeah.
Who cares is what's going to be on the exam.
That's the big thing is that, I'm pretty sure half of the students, at least in my class, because we talked about it all the time, was, hey, did you hear anything that's going to be on the test? Do you know what's going to be on the test? Or what about you? Or you go ask somebody that, hey, what did you have on your, on your national registry? And it's not that, you're trying to cheat or anything, but you want to be prepared. You go,
Right.
You go through anything, you want to be prepared. And it's just funny because, I don't think maybe like 3 things that I ever got told by other people were on my actual national registry because it
Yeah.
was just, or at least that I remember.
Right.
Because I got so focused on my national registry and what I took, I actually failed the advance the first time I took it, and it's because I walked in there and did that whole. This next 45 minutes, this next hour and a half is determining what I've done for the last year and a half. You know, and I failed it, and I literally walked out of there going, I think I did great. And you know, when I rolled over in bed that morning and took my phone out to check and I failed, it literally was a shock. You know, and I was like, man, I went through nursing school. What is going on?
But what was it like when you went back and you took it the second time and you passed it?
When I took it the second
time,
time,
what was different?
I was relaxed. I literally walked in there and it was.
So you didn't really do anything in between that increased your knowledge or anything. It was
I went back and I would look over like the study guides, the notes that I wrote.
The same stuff you did before.
And the thing is like I had started paramedic school and literally somebody had told me, you spent all this money to get your advance. Why are you not going to test? And I was like, that really makes sense. So I paid it. I went to take it, and I went in with the mentality of, I'm going to start paramedic school, whether I pass this or not, but I want to pass it, you know, because I put the effort into it, and I walked in, and literally the next morning I got those results that I had passed, and I actually left that exam going, I didn't. Did we go over that? I mean, like in honesty, I don't remember that, but yet. I really feel like it was because I went in there relaxed. I was like, it's either going to happen or it's not. I got to go with the punches either way.
I mean, that's the key. People get hyped up about the tests. Did you do any practice tests before you went in the first or second time?
The thing is like that's the other thing I was going to say is that, we asked everybody, hey, what questions did you have? What did you use to practice? What did you use to practice? And and everybody's got, well, I use this. Some people are like, man, I didn't do anything.
That was me the first time around. I just showed up to the test, I passed it. I don't know.
And that's fine, but for me, it was more of as I said, I'm a talker. So I will sit there and I'll talk out, I'm going to do a head-to-toe assessment. What am I going to do in this assessment? I'm checking the head. I'm looking for this. I'm looking for DCAP, BTLS. And I literally had to sit down with myself, and I'm pretty sure my wife thought I was crazy because I'm,
well, you are in EMS.
Yeah, that is true. But, I'm sitting here talking to myself and talking about what I'm doing. And it was something to fall back on. And I even remember taking the test going, I'm sitting there going, okay, there's the... all right, my secondary assessment. And I'm pretty sure people, the test-taking lady in her little window where she's watching is like,
is he okay over
what's
there?
he doing over there? So...
I would love to have one of them, by the way, come in and say, what's the weirdest thing you've seen go through that door? Yeah.
I would like to know that as well.
Yeah, you get hyped. And you honestly have to, at the end of the day, say, who cares? Who cares? It doesn't matter. Because you'll get the new graduates out into the field, and you've seen it dozens of times. And it's like, who cares? Just stick the patient. Who cares? Who cares if they have brown pants and a gray shirt? They're getting cut off. I don't care. I don't care what that is. Well, they have a history. Right now, I don't care. They need CPR. That's all I care about. ABC is all I care about, and that helps.
Always falls back on the basics.
Yeah.
Always. Even in paramedic school. The best thing that I've learned out of paramedic school, and I know this sounds really dumb, and I'm pretty sure people are going to hate me for this, and they're going to say I'm wrong, but the best thing I ever learned was to walk up and go, sick or not sick?
Yeah.
Are they sick? Do I need to intervene? Or are they not sick, and we can figure out what's up? How's your night going? I mean, it really falls into basics. I mean, are they alert and oriented? Are they talking to me? Or are they just falling out and, are they sick or not sick?
Exactly.
Yeah.
Exactly. Have you seen How You Met Your Mother? You play a little Have You Met My EMT? And you push them ahead. Because that's exactly what you're doing. And you get, especially, man, there's so much stress at EMT. There's less stress at A. And then it seems like there's even less stress at medic when you do that. Now there's more writing at the top. But in the field, once you get there, the medic is exactly what you do. Do I need to handle this? Nope. Have you met my EMT? There you go. But when you're an EMT, you think, I gotta save the world. You're really gonna stop the bleed. That's what you're going to do and bag the patient. Those are the two major things you do as an EMT. That's it. Focus on that, and you're fine.
And you would be surprised how many EMTs save medics, because medics will get in their heads.
Yeah.
You got to do the advance.
And I've had plenty of medics that I've even rode with, and they're like, man, what should we do? And it's like, hey, let's just give them some oxygen and see what happens.
It's the old saying, man. Paramedics save lives, EMTs save paramedics.
Yeah, I always hated that, only because most of the EMTs that throw it out are super cocky. It's like, I could crush you. You don't know what you're doing. Shut up. From the live chat, do you have a question? Do you have something that you do for a test that's always getting you down? Do you have anything you want to ask us about test taking skills? Because it's all plays in
that's
together.
Helped you.
That's helped you, yeah. But yeah, I mean, you really can't care when you go in. You got to go in. You just got to know you know it. I am horrible at studying. I did not study at all for these tests. In the traditional, what I mean by opening that book or looking at your notes, have you read your notes? And Tom and Vanessa actually will both say to people who are struggling in class, or even, I think one of the things I've heard y'all say is like somebody's failing an exam badly, they come in, okay, you got to do the quiz again. But have you read your book? Did you look at your notes? My uniform answer is going to be no, but I'm not failing the test. Because my answers are, I read it, I absorb it. I make my notes on the things, and I have my own way of making notes. And that chapter 5, I'm going to come back to it, man. 4 pages, double-sided notes. When I make a note, I'll put CARD for cardiac, OU for output, equals, blah, blah, it's just this little shorthand. Mm-hmm. So it's half the page. So I've got double columns on either side of the page, flip it over. 4 pages on chapter 5. And I was struggling with it. And, I mean, I passed.
That's all?
Yeah. Now, I hate that chapter, man. I hated it in medical school. I hated it for
That's
advanced.
what I'm going to have him teach it.
That's. I'll teach it. Like, here's what you need to know. Memorize this, this, and this. You'll pass the test and move on.
That's to be honest with you, just some people.
It is a good foundation, but yes.
Some people, that is the best way for them to learn.
Yeah, for some.
I mean, you've got to find your niche. Mine, as I said, is talking it out. If I go through and I can talk it through. Oh yeah.
All right. Good. I want to address something in the chat room. Go ahead.
And that's why I stress, like in EMT, learning the 21 steps of blood flow. Because a lot of times there's going to be some questions in there on physiology that they're not going to come up. They're going to ask you straightforward. But if you can work it, if you can work the puzzle, and you know it like that, and you can work the puzzle like that, then you can figure it out.
Yes. I mean, there's all kind of different examples we can give of tests that are, here's the pattern. It's pattern recognition is what it comes down to. Here's the pattern. We left you 2 blanks. What goes in those blanks? And Carrie Phillips, all right, you are the key student that I'm going to say, breathe and stop. You just started the class 3 weeks ago, and you're sitting here telling me that I need study tactics. I feel like I'm struggling. Because you're carrying too much and pressurizing yourself. We had another student, wasn't in the September class. No, it was September class, yeah. Same thing. He came in the office like, I'm struggling. It's like, you've taken 2 tests.
And making like passing grades.
Yeah, making passing grades. You're too early to be stressing about any of this, which means it's the stress. It's not the studying.
Is that Carrie you're talking about?
Yeah.
Carrie, just so you know, chapter 5 is hard. And it gets easier as you go. Because
tell her what you told DeAndre yesterday.
So chapter 5 is built like it's a foundational chapter. You may not understand everything in that chapter right now, but as you progress through the program, we'll get to the medical chapters and the trauma chapters. It's going to review those individual systems that are important, and each individual system will get reviewed again throughout the program. And whenever you come to class and you take it and you did chapter 5, that's like a primer. It's like priming the pump, getting things ready. And then whenever you start reading respiratory emergencies and cardiac emergencies and trauma emergencies and chest injuries, and it's doing the reviews of those chapters, and you come to class and you put your hands on it and you start doing it, then everything will start clicking. It's like pieces to a puzzle. When you're putting a puzzle together, you do not quite know what it is. You're just putting the puzzle together, and then all of a sudden that one piece brings it all together. And that's what chapter 5 is. It's just one piece of the puzzle. Just hang in there, Carrie. You're doing great in the program.
Yeah, everybody is. I mean, it's early on. You're doing just fine.
Oops, sorry.
And it's way too early to be stressing about this stuff. And to be fair, when I hit 5, but the pressure I put on myself was, okay, Tom's wanted me to do this so I could teach. He's worked with me before, so I can't look stupid. And, you know, I got to get past this stuff. And reality was just do the stuff. Because it does. Even after doing it before, hitting chapter 5 was a bit of a struggle. But once I just let it go, say, okay, I passed the test. I'm going to move on. Because I wanted higher grades. So I'm like, screw it. I passed the test. It did click. I was sitting there telling DeAndre yesterday about questions about the heart. Is I just physicalized it. I literally, any question that came up on that test, I touched my heart and went, okay, this is right. I use my right hand, so I always remember right and left. So I get them mixed up sometimes. Right. Okay, lungs are on the right, so it's going to go this way to lungs. I know our artery and veins are reversed for that, blah, blah. So, because it wasn't asking me the 21 steps of blood flow, which I didn't memorize. But I've got, I couldn't tell you in order, but I probably could tell you.
Tell me something.
Ultimately.
Give me something to hit this mofo.
You know, because I got more stuff in my brain that I got to remember, like how to run the Facebook page and the heart flow. But every time a question came up that had a specific question, I went through the basic steps of, okay, this is where this is. All right, this is that valve, or this is where it's going. And it'd be something about if you have pitting edema at JVD. I still ran through the steps and go, okay, this is where it's going to back up. The JVD
this is where
was
it's
the key.
coming. This is it.
You know, another test. Okay.
And Rachel says, just backs us up there. If you see, like, Rachel says, yes, chapter 5 all makes sense now. Because she says, yes, Carrie, chapter 5 was tough. I got chapter 5 through. Now I struggle with this other stuff. Dawn told me it's because she's does hospital stuff, and we're doing pre-hospital stuff. So it's a little different, and that can throw you. But she also goes on to say that yes, but now chapter 5 all makes sense after many weeks after we've gone through chapter 5, because now you're starting to put those pieces together, and as it comes together, it'll come together like a puzzle does all of a sudden almost.
Yeah. You can always fall back and review. That's the big thing, is that you can always, if it's a big chapter, you know, get your foundation from it, but you can always fall back and review.
Right. And then the other thing that we've always said here is other schools, if you fail the exam, you're out. Or it's just a fail and you can't make it up and you move forward, it hurts your overall grade. Here we'll work with you if you're failing it. We'll work with you we'll give you the skills you need to review it, and then you can take it again. And then if you fail it again, we can still work with you. I mean, there's an ultimate point that you're just not getting it. You're just not getting it. There's the only test we do. But right now, I mean, I think this plays into test taking so much is everybody's so worried about what's next. Focus on what's now.
Yeah.
I had to focus on what that question was in front of me. And the reason, I know the reason I failed the paramedic was I overthought it. I have to pass this thing. It's at the time, it was on paper. It was 200 something questions. It was 2.5, 3 hours long, and you're just drained. I mean, you're just worn out at the end of it. The second time I took it, I was like, you know what? And it's the fear of the unknown. That's why I asked you if you took tests practicing, because that's one of the things I advised on my video that I put out was practice the test. Get any test site you want. I use medictests.com. I really loved it. We're going to actually try to get them to work with the show here and sponsor us, because they really they do a good job. But it didn't matter what it was testing me on. It was a fact that I couldn't go back. I couldn't change my test. I practiced focusing for 45 minutes to an hour. You get 2 hours, depending on the test. I mean, you can get up to 2 hours. But practicing just focusing for that time period, getting these, answering the question and moving on. Because that's test taking skills. Because you'll get hung up on, I know this, but I went blank. My mind went blank. What do I do? Well, one, you can flag it and come back to it. But two, practice that of just stopping your brain, picking an answer, and moving on. Because the great part is, then you get to review the test, and it shows you, this is what you missed, this is why this answer is correct. And the why is what matters. Because once I understand the why, I get it. Again, that's so when I'm saying I don't do studying, I don't read the book, and I don't look at my notes. I write my notes, I throw them away. Because the act of writing, for me, that's my niche. The act of writing helps me remember it. Yeah. And so I've never.
It's like back in the day when we had to write our spelling words 10 times each.
Yeah. I mean, it works for everybody to some extent. But if studying is your thing, reading that book, read the book, but don't do it the night before. Or work. Don't get in the parking lot an hour early and read the book.
Yeah, studying is a long-term thing.
Right.
You can't, if you want it to be on long-term memory, you can put it in short-term memory long enough to pass the test the next day. But that's not what you're wanting. You're wanting to be able to remember that for a long period of time.
So yeah, absolutely. And Carrie is going to go for her A eventually. She's in the EMT class now. Rachel was asking specifically, but that unknown, you get sideswiped because you're focusing on the 21 steps of blood flow. I got them, blah, 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 and then you get hit by the security and it throws you off. And you get hit by the second security. Then you get in the quiet room. We talked about that. Then you get hit by just never having taken a test on a computer, maybe. Right. So practice all those things. But even the psychomotor. Even having done it forever, I had to take the psychomotor here. I got on YouTube and typed in National Registry A EMT psychomotor just to see it. Because once you see it, it takes away that fear of the unknown. I went, oh, yeah. Because I'm thinking, and I've tested these. Like, I've been in the stations where people have tested, and I've been the patient and watched it. And I know some of it's easy. Like, come on. Swing and sloth, it's super easy. It is. But you do find, Rachel mentioned medical assessment, trauma assessment. It's like, no, it's like the real world. Are they sick? Are they not sick? And watching the video of somebody just doing the practice station, well, oh, yeah, no, I can do this. And I went in, and I still overhyped on the first station. I did the medic thing. You know, it was the baby pediatric respiratory compromise. And it's like, the baby is grunting or something, and you can see it's gray. I'm like, all right, give me the baby. And thankfully, the partner went, I'm not done telling you the scenario. And, they slowed me down because instantly I jumped 20 steps ahead because as a medic, what are you going to do? I know what's going on. Give me the baby. I'm going to put the airway. Oxygen. Oxygen will fix this kid. Let me do that right now. But with the test, you have to do this, do blow by, do this, do this, do this. Now you get the baby. Now because the test is showing the steps. Whereas the real world is, I know what I got to do. Shut up and give me the baby. And so they slowed me down. Then the rest of the stations went fine.
But in the real world, you're going through those steps like this. Some of them are at the same time.
Yeah.
There's a lot of your assessment. I mean, in real world situation, you're not going to walk up to a scene and go, "Oh, is the scene safe?
Yeah.
Do I have BSI on?"
You're doing all that at the same time.
I do that as soon as I get out of the truck. Is is PD on scene? PD's on scene. Is this a domestic? Is this? What's going on? Okay. In my mind, I go, okay. Is the scene safe? Scene safe. Yep. I've got gloves on because I've already. All this is happening in a matter of a minute.
this because it's on.
Right.
Yeah.
And then you get out and your patient's standing on the side of the road. I can go, he's standing. Obviously, we're okay that part. Is he breathing? Hey, I'm Michael. I'm your EMT. Can you tell me what's going on tonight? Oh, well, all right, we're breathing. Our airway's good. He's making eye contact with me. I'm like, let me reach out and grab this guy. With me telling him first, hey, I'm here to help you, and I'll put my hand on him. That way I can feel, is he cool? Is he, clammy? Is he diaphoretic? You can work all this stuff out in a matter of seconds. In National Registry, you go in there and, scene safe, PSI, my mechanism of injury is this. It's good to get that as a foundation. So learning it up front is good. That way when you get out here to the street, you can fall back on that because you may get out of the truck and something is just not right.
Right.
I mean, you can. Yeah. I've had that situation where you get out and you're just like, this is just not right. There's just something not.
Yeah.
Something's going on here that I don't know and I need to reevaluate.
Yeah.
So I can back up and go, this mechanism of injury that I heard is not what I'm getting. So maybe I need to rethink this mechanism.
Let's start. That's on. It didn't actually pop up this time on the practice test and on your final exam that popped up of blah 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 scenario, blah blah blah. You've already found this in this test. You're halfway through transport. This changed. What do you do? And the answer is start your primary assessment over. Is what you do because every time something changes, you start over at the top. And that's a great question there. I hate autocorrect. It does hate me. Thomas. One of the It's Frank Herbert's Dune. It's the most famous quote out of that book and movie that people use. Fear is the mind killer. And that's exactly what we're talking about here is fear will stop you. It'll stop you from passing that test because of all that's the opposite of what I'm saying. I say don't care. That's the flip side of that. Because if you're afraid, if you're stressing, if you're focused on the bad that can be, you won't just go do it. And I didn't even, man, well, I didn't even know I passed my test. I started getting texts from Tom. I was trying to make coffee. He's like, congratulations, man. He'd gotten up. He'd checked from the instructor side. I was like, well, thanks. I'm going to hit my coffee now, and then I'll be happy later. And I was very happy later. And it still makes you happy. I mean, even after so long, just knowing you can do it, it feels good to do it.
Hey, right quick, I see Jeremy Mathis joined. Hey, Jeremy, congratulations on captain. He just got promoted to captain.
Good job.
At the fire department.
Nice.
Congratulations.
One last thing I want to talk about, you're talking about your instincts and the fear. And actually, Carrie is a first responder, and she was saying what's throwing her down, too, is when she's on call, she just does it. And you're talking about verbalizing, and that's why I reiterate. It's like just slow down, think about what your instincts have told you to do, and then verbalize everything that you're doing. That's what's going to help you get past that. But I was thinking about the other side where you're talking about, you look around, you just seem safe. We rolled up what turned out to be possible attempted suicide, and it was a trailer on this piece of land, kind of out in the middle of nowhere. And my partner was the most scared EMT I've ever seen in my life. I almost went like, "Why are you in this business? I mean, you're scared of everything." And he's like, "Oh, look, with SO." And I mean, there's somebody flagging us down. There's somebody that's like, "Dude, we're here. It's fine." And he's like, "Well, I'm not getting out." I'm like, well, I hope the guy didn't come out of the barn and shoot you. We had no idea where anything was. I just randomly said that. And I go in knowing, trusting my instincts, right? Trusting that scene is safe. You went in and it was safe. Turns out there was a guy in the barn and now he didn't bring a gun up, but there was a guy in the barn and there were guns in the barn and he came out of it and my partner about crapped himself. I'm like, you should have been with me. We're safe inside the house, moron. And I tried to tell him that. It's like, now you realize if we don't leave the scene, which I don't know what the actual law was, but it's like once I'm there, I don't think I can leave the scene. It's one thing to know ahead of time in the stage, but we were pulling up, and then it's like, no, you're supposed to wait. Well, too late now. So it's like, if you don't leave the scene, you're sitting duck in that truck, man. And sure enough, the guy comes out, he scared him, it was funny. But it was fine. It's like, no, I've been to a bunch of these. I'm going to take it seriously. I'm going to watch it. If I think anything's hinky, we're out of here. But you got to trust your instincts because fear, it'll get you killed. It really will get you killed out in this field. And it'll get you to fail the test. It'll get you to fail out in the class. One of the worst things I've seen fear do in our school is somebody had life change, right? It got difficult. Something happened. And they were afraid to talk to us about it. And then they missed their payment and they're not showing up for class. And they're afraid to talk to us about it. And had they just talked to us, everything would have been great. But what ended up happening was, at the last minute when we're like, there's no way you're going to pass this class. There's nothing we can do for you. Oh, well, here's what happened. Great. I wish you told me 3 months ago. But you were so afraid of what was going to happen, you brought it about, and now you failed out of the class, and you still have to pay, or you're going to collections, all that jazz. And it's all this negative ramifications. You just got to do it. What else y'all got before we get out of here?
Just,
It's 4 o'clock.
Time for you to take your medication?
I got a headache. I could use some medication. It's time to go to that bottom drawer where that liquor you gave me is.
Okay. Yeah.
So,
you are getting old.
Says the man who's going to be turning, 65 in a few days?
It's dementia kicking in.
Look,
the first stage
it's
of
all I
dementia.
know is Roy wishes you a happy birthday. And I mean that Roy from Emergency, because y'all worked together back then.
Okay.
Yeah.
No. Wrong one.
Speaking of old guys,
Yeah.
I will say that would probably be one of my biggest thing is that, you learn the foundation in school. That's good. Pass your test, get out there. But when you get out there, look at your old guys and let them tell you what they know.
Yeah.
There's so many times I see new basics that come out and they're just like, well, I read in the book, this is how we do it. This is what we're going to do. And you're like, you're trying to, tell them, hey, I understand that, but you're headed down a path of wrongness by, saying, hey, well, I hooked this guy up to a cardiac monitor. You didn't hook a guy up to a cardiac monitor. You're supposed to be taking a blood pressure and a pulse.
Yeah.
You know, you go to put that in a report, and this guy walks into this hospital and has a heart attack. They're going to pull your report and say, "Oh, you hooked him up to a cardiac monitor. Why did you not say anything?"
Yeah.
You know, I've seen people fall into that. You know, well, I've got to document it. I hooked him up to a cardiac monitor. No, listen to your old school medics. Listen to your people that have been in this business longer than 5 minutes that you have.
Mm-hmm.
They've got something to tell you. Ask, you know, there's nothing wrong. I have no problem asking somebody that's been in this business for 20 years. I've been through nursing school. I've been through this. I've done this. I've done this. And I'm not saying that to brag. I'm saying that because I continue to learn.
Yeah.
I want to learn what's next. But I'm always willing to ask that guy that's been in the business a little bit longer than me, that's been in a business a lot longer than me, hey, what do you know? What's the things that you know? You know, when going through paramedic clinicals, I've gone to hospitals and I asked the charge nurse, what is it you want to hear from me when I call in a report? Not, you know, not this.
Yeah.
What do you want to hear?
What do
In
you
labor
need?
delivery, what do you want to hear when I call in report? You know, what's the extra stuff that you don't need to know? Or what's the extra stuff that I'm not saying that you do need to know? You know, keep an open mind. As I said, it's practicing medicine. It's not doing medicine.
Yeah.
Well,
Yeah. And to that point, sometimes you need to fail to see that life goes on. Because I know I got pressured. Paramedic, life's in your hands. Paramedic, life's... No, not really. I mean, once you realize there's very little percentage-wise that you do on a daily, every call basis that changes life and death. You know, it's very much we'll keep you on the path of living. We'll tweak this. We'll help here. We'll help there. But it's there, and there's some life is in your hands. But once I realized I messed up on a call and the dude survived anyway, you know, okay. And that's what brought it up was Rachel saying here is like, she stressed before this test. She'd had a tough day in the ED. She failed the test and she cried. And then she looked at her grade average and it dropped to a 97. And then she goes, "Oh, that's not. I failed a test and I'm still at a 97. No big deal.
Life goes on.
Life goes on, and that's the biggest thing you get. That takes the stress out. And I think, Gary, I'm gonna have to correct those words. I think that's wrong. It's easy in the field. It's a different ball game for me in the classroom. It's all the same. It really
just
is.
your perception.
It's your perception. If you look, let me phrase it this way: saying you're wrong, because that never brings any good. Let me tell you this: if you look at it as it's all the same, then you bring it together all the same. Some days you're going to be doing IVs in the field. Some days you're going to be teaching EMT, so you got to think about all the stuff you're doing. Because even as an advanced, you can be teaching EMTs, right? Or other advanced students for that matter. So you do different aspects of it. It's all basically the same. So just focus on how it all works together and figure out what's working in the field for you and bring it to the classroom, and vice versa. Figure out what's working in the classroom and bring it to the field.
Foundation.
Yep.
You got to set up that good foundation because there's going to be things you forget. Stuff gets fast in the field, and you know, and somebody could go, "Well, did you check a blood sugar?" And you're like, "Oh, yeah, I didn't."
Yeah.
And you go to check a blood sugar, and this guy's, you know,
Dang.
42, and you're
Yep.
like, "Oh,
Oops.
well, if I'd have just checked that in the beginning."
But you won't forget that again.
Yeah, you know,
Yeah.
now you look like, you know, like mud standing on the side of the hospital, you know, holding the wall because now your patients, you know, you're trying to figure out why they're lethargic, and if you'd have just checked the blood sugar, you would have known.
And I never checked. I definitely did not check a blood sugar on every patient we saw in my career, but now that's standard. I mean, the first thing before I even get a line, AMR wants me to check a blood sugar. Like, okay, sure, if that's what you. And so everybody got blood sugar. Everybody got blood sugar. You know, you might not get oxygen or a line, but you didn't get your blood sugar checked every single time, which is good. So we gotta get out of here. We've been doing some stuff. It's getting hot. So you finish up 2 months in paramedic school?
2 months.
Man, that whole portfolio. What is that? That's another reason why I wouldn't challenge paramedic again. They said portfolio. I'm like, no thanks, pass. What is that?
I have no idea exactly how.
So I guess y'all will be working on that for the next 2 months.
We actually, as a matter of fact, start back on Monday, as a matter of fact, starting on building all that up and everything. It's a long process, and I recommend everybody that starts in EMS to continue your education and stuff like that, and just building a good portfolio to have, because that's key. That's really key when that's going to let you pick where you want to go. So
Yeah, it's different. We did. I think you probably did the same medic test I did, where it was 3 cards and they picked it out and you sat across the table. I excel at that. I mean, I talk. That's what I do, and so I excel at that.
A static cardiology.
The static cardiology.
cardiology.
That was super easy for me. Where it hurt other people. It was a written test that got me. But when they said they've changed the psychomotor to everything's done on one patient, I'm like, well, that's awesome. A lot of old medics think that's hard. Like, I think Jason, he was even going, oh, I wouldn't want to do that. I'm like, no, but that's how we do it in the world.
Yeah.
Give me one patient. The scenario is, all right, oh, things changed. Okay, I'm going to run to that. And now I can see how it might be intimidating to a medic student. 'Cause my medic's test was just like every other test that you do. It was, here's this station. You're only doing this part of that station. Here's this station. It's shock.
Mm-hmm.
You know it's shock. So you're going to go in knowing it's shock. How do you treat shock as a medic?
Right.
The dopamine and all that jazz.
But the other thing is you put that into real world experience. I mean, you have multiple traumas on the
Yeah.
same patient. You have,
Yeah.
you have a guy who, one of the things with cardiac, somebody going into cardiac arrest, your H's and T's. There's something else that could be causing this. So you have to go down, are they hypovolemic? Are they hypoglycemia? Or, there's other things that, so, I'm kind of happy about that. But, again, I'm used to the one station, one station.
Yeah.
Let's knock this out. Let's knock this out. But, to me, it again goes with building that foundation. Now I've got that.
Mm-hmm.
I can run with that.
Now, the one last thing I wanted to ask you, I meant to ask it earlier, and I'm circling back to it. In your experience, you're in medic school now. I've always recommended doing 2 advanced and then working for a while and then going to medic. Was that your experience, and what would you recommend?
I really recommend, get your basic. Once you get your basic to work, take your advance, and then take a little bit of time because, paramedic school is very hard. I'm not gonna try to church it up or try to make it any kind of glorious thing. It's hard, I want to say when we started, we had 32 people, and we're down to 11.
Wow.
And people, they realize this is hard. This does take a lot of time away from my family. It takes a lot of time away. But then again, it also takes a lot of time to get that foundation. When you are studying and you are taking that that whole time that, man, all this stuff has to be learned. You can get on a truck and again, as I said, talk to an old medic and say, hey, what do you know about this? What do you know about cardiology? What do you know about respiratory? What have you seen? And and a lot of medics out there will tell you, back in my day we didn't have this and that, but but they're telling you, if you read into the story, they're telling you the same thing that the book is telling you. They're telling you the same thing because that's how they learned it. They learned it on the truck. They learned it, somebody had to show them, and it's a great thing. Just, I would say take some time, ride a truck, whether it's emergency or IFT or, something, just get your foot in the door because, there's a lot of money involved in this. And if you find out that, I'm just going to go straight through paramedic, you get out there and you find out that these 12-hour shifts or 24/48s are not the lifestyle you want.
Yeah.
What are you going to do? You spent all this money. Take that time. See if this is what you want to do.
Exactly.
Don't rush in because you're going to be that paramedic that goes, well, I've been in school. I know what I'm doing, and you're going to get out there, and it's going to spank you. It's going to spank you hard.
Because the reality of the world is we're hurting for medics. We're hurting for medics. So it doesn't matter. In the perfect world, they'd put you with another strong medic. They'd let you ride for 2 or 3 months, really get your feet wet. What'll happen is you'll get 1 or 2 shifts, and, hey, we were going to let you ride, but we need a medic. So you're the medic in that spot now, and now it's your truck.
You haven't killed anybody yet. Go ahead.
Yeah.
You haven't done anybody any harm. And it may be the first 2 nights you had all psych calls, and you didn't even have to do a thing.
Yep.
You know, and now your very first call on the shift is you're running a traumatic cardiac arrest,
Or that CHF patient.
and and you're fumbling around, and there's not a, you can call medical control and you can call this and that, but ultimately it's going to fall on you.
Yep.
You have to say, I've got that foundation that I can walk in there and I can do this.
Yeah. So that experience of working in the field. Plus, I think it helps you get through the learning. Once you've had real world experience of seeing how it all works together and got that new washed off of you. And so you're comfortable doing the medicine. Now when you're in paramedic school, while you're learning new stuff, is building on that foundation, and you're not scared of it. I've worked with a few 0 to 0 medics that went straight through it. It took them a lot longer to become decent at what they did than somebody who'd worked in the field first. I think.
This is a very humbling job.
Yep,
Yeah.
it can be.
So to that end, we've got EMT class starting November 12th. If you know somebody who wants to start getting into the field, first responders want to step up, firefighters, just anybody. EMT class, November 12th is orientation. It's a 10-week class. December 5th, if you want to go from EMT to advanced, we're starting a class on December 5th for advanced. And December 1st, if you finish advanced and you need that psychomotor exam,
Come
we've
take
got
the registry with us.
National Registry going on. So that's what's happening this year. October 31st, what do you got going on, Tom?
I don't know what.
October 31st, we've got a big haunted house going on right here in Covington.
Yep.
As students, if you want to volunteer, we need bodies to have fun. You can dress up, not dress up. I don't dress up, but if that's your thing, you can dress up.
He's
Help scare
scary
people.
enough as it is.
Yeah, I'll tell you you're wrong all day long, and that'll break your heart. But we need people to help with the games, handing out candy. We do have a haunted section and a non-haunted section. So if you're watching this, you got kids. We've got a huge kid-friendly section that we're going to do. If they're into getting scared and do the haunted stuff, we got that too. It's free. We're asking for donations for Matt Cooper.
It's free. I'm not going to ask people for money, but we're going to have a bucket or something out. Come on, 148 strong.
So that means
for
you got to
Matt
donate
Cooper.
$148 every time you walk in the door. That's what it is.
Yeah. Come on, let's help support Matt. He's doing a lot better. He's doing better. Keep prayers. And they still need a lot of support. So
Yeah.
let's do it and let's come on out.
Yeah,
just just a dollar helps. If not, still want you to come. Still want you to come and enjoy it. So
Absolutely. And anytime you have any questions, I saw somebody in the chat room early on had said, if you're struggling with something, ask the questions. That's the only way you're going to get it fixed. You can come to, if you're in the class, of course, ask the questions at class here. If you're not, and you're just in the field or you're in another school, we don't hate on you. Hit us up here.
Hit us up.
My email is right there on the screen, charles@gaiems.com. You can email me directly, and we'll deal with it here on the show. Hit us in the live chat room. Topic Tuesdays are coming back fairly soon. Now that our schedules it'll be November before it
probably
happens.
as soon as we get done with the, we're doing refreshers at Dobbins Air Force Base right now. So 3 days a week, we're at Dobbins Air Force Base for the month of October. So, until we get that done, then we'll start throwing some more things and plan on doing a few more stuff, on here so we can bug y'all and have fun.
And if you find yourself watching us and you're throwing out your 2 cents and you're finding like, man, I could share this knowledge, I could share that knowledge. We're looking for people like that. If you've got a level 2 instructor, we're looking for level 2 instructors. If you've got advanced, you can do lab assistant. We need some of those too.
Yeah, we're pretty good on the lab assistants right now. But
never mind. Get out.
If you're advanced EMT, here soon we'll be doing an instructor class to help you out. So we do have approval for the instructor class. We're about to start rolling it out around the beginning of the year. And we can get you squared away to become a level 2 or level 3 instructor.
All right, well, check us out next week. We're going to have fun. We're going to talk about some more stuff. And hit us up with your questions so we can always help you out where you are in your community.
See ya.